In 2014, something changed in the city of Flint, Michigan. To save money, officials decided to switch the city's water supply from treated Lake Huron water to the local Flint River. On paper, it looked like a temporary cost-cutting move. In reality, it became one of America's most shocking public health disasters. At first, people noticed small things. The water looked brown, it smelled strange, it tasted metallic. Families complained that their skin was breaking out in rashes after showers. Parents said their kids were getting sick, but officials kept saying the water was safe. What most residents did not know was this: the river water was not properly treated with corrosion-control chemicals. Without that protection, the water began eating away at old lead pipes. Lead started leaking into the drinking water, flowing directly into people's homes. Lead is extremely dangerous, especially for children. Even small amounts can damage brain development, affect learning ability, and cause long-term health problems. Over time, tests showed that many children in Flint
Thank you all
had
for being here. Our
elevated
work
lead
is at a
levels in their
critical
blood.
juncture. Vigilance and collaboration are
Doctors
key.
and local
Understood. What's the
researchers
timeline?
began
Very soon.
raising alarms.
The
One
results
pediatrician
show a
compared
minor
blood test data
issue.
and saw a
Is
clear
it
increase in lead
serious?
levels after the water
No,
switch.
it's easily
Independent water
treated.
testing by
Good.
residents and scientists
Thank you.
confirmed the contamination. Still, officials were slow to admit the scale of the problem. By 2015, national media started paying attention. Protests grew. Residents lined up for bottled water. Volunteers and charities shipped truckloads of water to the city. People felt betrayed. They had trusted their tap water. Now they were afraid to drink, cook, or even bathe with it. In October 2015, the city switched back to the original water source, but the damage had already been done. Corroded pipes continued to leach lead. The crisis did not end overnight. Investigations followed. State and local officials faced criminal charges, though many cases were later dropped or dismissed. The crisis exposed deeper issues: government accountability, environmental injustice, and how poorer communities often face higher risks. For years, Flint residents relied on bottled water and water filters. The city began replacing thousands of lead service lines. Federal and state funds were allocated for pipe replacement and infrastructure repair. But beyond pipes and policies, the crisis left something harder to fix: trust. Many residents still do not fully trust their tap water today. The psychological impact remains strong. The Flint water crisis became a national wake-up call. It showed how decisions made to save money can cost far more in human health. It also showed the power of community voices. Without residents speaking up, testing water themselves, and demanding answers, the truth might have stayed buried. This is not a story from a distant past. It's a reminder that safe drinking water is not automatic. It depends on careful management, transparency, and accountability. And in Flint, Michigan, that lesson came at a very high price.